Welcome to home care, daycare, and memory care. What you need to know, this is, of course, a community dementia education program of Alzheimer's San Diego. My name is Amy Abrams. I am the Director of Education at Alzheimer's San Diego, and I'm delighted to be co-presenting today with my colleague, Jean. I thought I unmuted you, sorry. Well, let's see if there we go.
Yeah. Hi, everybody. I always say glad to see you.
We're really delighted to have you with us here today. Please bear with us on the topic of technical difficulties here. I want to make sure that you know that with us here today is a volunteer member of our tech team named Will, who probably also can't unmute himself. I tried doing that, but at any rate, Will is here. You see him on camera there, and he's here to help. So we know we're learning Zoom ourselves and figuring all of this out. We know it can be complicated and sometimes frustrating. So Will is here in the event that you need some help figuring out chat, configuring your screen, whatever it might be. If you're having a hard time finding the chat, then just give our office a call, and reception can connect you right to Will for some help. Our main number is there in the chat box, but it's also at the bottom of all of our slides, 858-492-4400. So we're here to help. We want to make sure that this online environment is as comfortable and user-friendly as possible, but we know that there will be some hiccups, so we appreciate your patience. We have muted all of you, at least we think that we have. We find that Zoom sort of gets wonky with us sometimes, so you may find that your volume has, your audio has come back on. We'll try to keep an eye on it, but please, we would ask that everyone remain muted just so we can minimize background noise and distraction. And video is up to you. We won't be asking anyone to come on camera today, so if you want to turn off video to reduce distraction, you can do that, but we're okay either way. So questions, even though we're turning off sound, we want you to participate and ask questions. So in this platform, we do that using the chat box. So if you haven't already, please go ahead and find that Zoom group chat. It's up or down, depending on your computer or your device, in the controls. There's someone. Yeah, we'd love, just say hello, send a chat, and we'll know that you found us, and we'll know that you're here, and you can get a little practice. This is how you can submit questions as we go along. This program is being recorded, but only in the recording, only our narration and the slides will be visible. The chat will not be visible, so don't want anyone to worry about that. There's a ton of information in this class. This is a very comprehensive overview of basically the entire long-term care system. There's a lot of material here, and we also will go through a lot of resources. So if you would like a copy of the slides from which we are presenting, just go ahead and send an email to that address that you see on the screen there, education@alzsd.org. We'll be happy to email you a PDF of these slides, so you'll have all of the information and the resources too. At this time, because we use Zoom video conferencing, we use the meeting software to run our education programs. We aren't collecting a registration list. You just clicked and then you were here. So because of that, we can't follow up and send you materials. But stay tuned. I'll tell you more about that at the end of the program. We are going to be moving to a new platform shortly so that you won't have to do that. We will be able to follow up with you. So for the time being, feel free to chat, take notes, but do know that we can send you a copy of those slides if you would like them. And again, Will is here in in the meeting with us, ready to take calls. You can reach him by phone. Just call our office at the main number, or just send a chat if you've got questions, and he'll be happy to help. So here is our agenda for today. It's comprehensive. We're going to cover a lot. We're going to talk about what long-term care is very broadly. We'll talk about the various places where long-term care is provided, and we'll start with help that is provided in the home setting. We'll talk about adult day programs and other types of community-based services. And then, of course, we'll talk about what's called the continuum of residential care. Assisted living, memory care, independent living, skilled nursing facilities. What do all those things mean? We're going to talk about what each of those are. We will talk briefly about financial considerations. We're going to be discussing the costs of all of this care, but financing long-term care is a big and complex topic. So we will cover it briefly and generally, but we will connect you to some resources for more information on that pretty complicated topic. And then, of course, we've got a lot of resources for you. I just want to say before we get going that, of course, we're talking about all of these services in very broad general terms. And the state of the world right now, while our county is still under sheltering in place orders, all of these services look a little bit different right now. So as Jean and I are talking about them, please just keep that in mind. We're talking in generalities. We're talking about how these services usually work, but there are different processes, different admissions criteria, different procedures right now. We don't know how they're going to change, of course, in the future. So we'll just ask for you to take that with a grain of salt, but do feel free to ask questions in the chat. We are going to pause a couple of times here this afternoon to read your questions and talk about them. So if you've got a question about how something sort of applies in the current environment, feel free to ask it. Okay, I'll turn it over.
There, am I back online?
You're there.
Okay, good, thank you. So we're going to get started here, folks, with understanding long-term care. And so let's just start by saying, you know, when we talk about long-term care, we're talking about the course of care over time. And I'm going to come back to that. We're not necessarily talking about a specific resource with long-term care. It encompasses many, many different supports and resources. So before we delve into that, here's really the question that we want you as care partners, as people living with or caring for somebody with dementia, to be asking yourself this question on a fairly regular basis, to be kind of assessing how you're doing, how things are going, and how your person living with dementia is doing. So is it time for more help? When is it time? And that question is different. You know, the answer to the question is different for all of us. We all have different levels of, you know, mental and emotional capacity and physical capacity to be able to care for people. And we have different lives that are going on. We have different resources available to us. So it's very independent to you, which is why I think, you know, it's important to ask yourself this question on a pretty regular basis. Do a check-in with yourself. And even better if you can do a check-in with other family members or people who are involved in the care of your person living with dementia. So we're all managing different roles and responsibilities. So we need to consider that as we're thinking, is it time for more help? I know there's households out there right now. Again, we're all sheltering in place. There's households that have a person with dementia in the household, maybe a couple of adults who are still working, and maybe some younger children or college-age children who are schooling at home. So that's a whole lot of different roles and responsibilities for the main care partners in that home. So think about that as, you know, as you're navigating how you're doing. Be assessing the negative effects on your health or well-being. This is very important. Amy, you'll agree with me. We can't tell you, unfortunately, over the course of our careers, both of us, how many times we've worked with families where the care partner's health has really taken a marked turn, a real deterioration, and then that's when they're reaching out for help. And that's good that they reach out for help at that time, but we don't want you to wait until there's something really horrible going on, or your health is really terrible, or there's a crisis situation. When there's challenging personality changes and behaviors in the person living with dementia, that can become quite an added stress to a care partner. Not just managing all the things that need to be managed during the day and care needs, but also maybe somebody who's being more challenging or more resistant or is angry or agitated more of the time. Increased personal needs often tips people in terms, tips the balance in terms of I'm going to bring in some more help. It's very physically and really truly emotionally taxing when you're having to provide more personal care to your person living with dementia. And I'm talking bathing, I'm talking managing incontinence issues, all of these different kind of things that really are very hands-on and can be very taxing. Other things we want to be thinking about is safety risks. If we're starting to see our person living with dementia starting to have more and more frequent falls or injuries or wandering, more exit-seeking behavior, which we know is happening more these days with sheltering in place. You know, we're antsy, all of us, and that includes our people living with dementia. These are all safety risks that, again, just put added stress on care partners. So think about these things. When is it time for more help? Do some regular check-ins with yourself. I think it's really terrific if you can partner up with someone who cares about you as well as your person living with dementia, who you can do some regular check-ins, because sometimes we don't see the changes going on in ourselves, and we need somebody else to kind of give us a bit of a reality check. Okay, so here we go to what I mentioned before in terms of looking at long-term care. You know, it's a phrase that we use often in this profession that Amy and I are in, and I'm sure you folks hear about it all the time. But again, what I want to go back to is for you to understand that there are many different services and supports that provide long-term care, and what we're talking about is long-term care over the course of time, as a person is starting to need some care, and a care partner is starting to need some assistance, and as it is changing over time, over the continuum. It is we are referring to non-medical assistance. So, you know, we're not talking about nursing care or doctors or any of those kind of things. We're talking about the people and the programs and the supports that help with what is non-medical or custodial care. So that's helping with, yes, the bathing, the toileting, the dressing. It's adult day programs, so helping with social activities and engagement. And then, you know, all sorts of other things as well too. So you'll see at the bottom of the slide, we're going to kind of go through all of these different areas of long-term care, with in-home care kind of at the start, and then moving through all the way adult day programs, residential care, and skilled nursing care. And I do want to point out, we are talking about paid professional services, but there's plenty of unpaid and natural supports that are out there. And by that, we mean you folks, family, friends, neighbors, churches you belong to, other, support groups, all of these other kind of supports that you are maybe utilizing, and that we hope you are. So what are some key considerations with staying at home? Well, we're not just talking about caring for the person living with dementia, but also think about the broader picture of the whole household, the environment we live in, all the things that we have in our lives that are important to us and important to our people living with dementia. So staying at home, making that decision, which many people do. I think probably if you ask most of us, how do we want to, if I'm diagnosed with dementia or some other type of illness that is chronic, how do I want to live out my life? Most of us are probably going to say, well, I prefer to stay in my own home for as long as possible. And that's fantastic. And having said that, though, it requires planning and thought. So how do we achieve this? Well, think about the things that we need to consider in order to stay at home. So if I am living with dementia and I live alone, I'm going to actually scoot all the way to the bottom of this list. I'm going to need probably some kind of custodial in-home care to assist me. I may need a personal emergency response system as well too, because if I have a fall or something happens, I need some kind of check-in, some kind of checks and balances. As I'm living alone in my home, am I going to be able to keep up housekeeping and household maintenance? Probably not. Probably not a great idea for me to be up on the ladder trying to change light bulbs and do things like that if I'm, have some kind of chronic illness that is perhaps dementia or perhaps something else that's affecting both my health and my ability to make good decisions. I for sure am going to need pet care because I have dogs, and those dogs need to be walked and they need to be groomed, and even down to the very basics, folks, there's some pickup needs to be done in the backyard. So I may need some help with that. And the other thing is I need to have a backup emergency plan for pet care if I'm suddenly admitted to hospital. Who's going to take care of my dogs? I'll need home-delivered groceries or meals, which I think we're all making good use of right now. So I think we've kind of got that one figured out fairly well. But let me just say also, as we all know, they're just delivering those groceries to the door. We've got to get all that food in and into the appropriate spots. And of course, we need transportation resources, especially as we're getting older. We may have made the decision not to drive any longer, or whatever it is, we need to be accessing transportation resources. And thankfully here in San Diego County, we've got some good ideas for you on that one. So that's kind of just thinking about things. All right, so lots of families start with hiring in-home care. And I am happy to say, as you will read here, that I think it was 2016, is that right, Amy? The Home Care Services Consumer Protection Act came into place as a result of some activists groups. I think it was CANR is what we call them. And we'll talk about that particular group a little later, but some lobbyists, felt that, and had been doing this for a long time with our state government, to ensure that in-home care agencies be licensed. And up until 2016, they were not. They are now. They are licensed. And, there's regulations that the in-home care agencies need to follow. And in addition to the in-home care agencies and the regulations they follow, this particular act also created a registry for home care aid employees. So what we would call independent contractors who don't work for a home care agency. And in this particular registry, the only way these folks can get on the registry is to be background checked. So those are some good options for families. The average cost in California for in-home care, and this was in 2019, was about $28 an hour. So this is not inexpensive. And here in 2020, that cost has gone up because the minimum wage went up in January of this year. And so, correct me if I'm way off here, Amy, but I don't think I am. I believe the average cost is around $32 to $35 an hour now.
Yeah, we see 27 to 35 is about the range we see in San Diego County.
So there's some variation there. So, and you know, that is reflective of the change in minimum wage, as well as, you know, the just kind of different overhead costs related to these agencies having to comply with the licensing requirements, which is a good thing. So what are some considerations when you're choosing an agency? Well, for sure, the hiring and screening procedures of that agency. So, you know, one of the things with that licensing requirement is, you know, the employees need to be background checked. And of course, that's a good thing. However, I think it's really important for people who are considering this as a care option to be also asking things like, does the agency check to see that their employees have valid driver's licenses? Do they have insurance, vehicle insurance? You know, if the expectation is that the whoever is providing the in-home care, if they're providing transportation for a person living with dementia, then you know, want to be sure that you know, those other things are in place, and that person that you're hiring through the in-home care agency is legal to drive and has insurance. So ask about those procedures. With regards to finding the right match, boy, I think we could spend lots of time on this one. And this is a really important one that sometimes gets overlooked. Finding the right match, what we're talking about is finding the right personality to work with your person living with dementia. And you folks, as care partners and family members, I really encourage you to put some time into this, thinking about who your person is and who they respond to best, what kinds of personalities, and then communicate that information to the agency. And ask them, what does the in-home care agency do? What are their procedures to find the right match? It's not uncommon for families to have to maybe try 2 or 3 different care providers, different people, before they find the one that is the right match for their person living with dementia and for their home. So if at first you don't succeed, what I'm saying is don't give up. You know, it takes a little bit of work and a little bit of persistence. Make sure you're finding out what services are and are not provided. So, you know, these folks are there to provide care, in this instance, to your person living with dementia. They aren't housekeepers. They can do some light housekeeping. If they're making lunch, you know, they can do that, but they're not there to provide you with a full meal every night as well, too. So make sure you're aware of and understanding what they can and cannot do in this instance. For sure, you want to ask about costs and any extra costs that may incur as a result of perhaps a last-minute change in schedule or a last-minute request for assistance, whatever it might be. Do inquire about scheduling policies and after hours and emergency procedures. So, for example, with scheduling, if one of your in-home care providers cannot make it, something has happened, their kid is sick, find out then how is that situation managed. Does the agency start working to find a replacement caregiver to come out to your home? And then that's even more important for after hours and emergencies. If you've got something going on with your person living with dementia and your caregiver that you expected at 8 p.m. this evening didn't show up, you need to know what to do. And, you know, is there somebody on call? Can you call and speak to a live person? What is going to be the standard protocol for a situation like that? Make sure you know what to expect, and what is reasonable and what they provide in terms of these considerations. So, and let me just add that we do have a list of in-home care providers at Alzheimer's San Diego. And if you call us or live chat us or email us, we can send that information out to you. Again, as Amy mentioned at the start of our program here today, you need to do probably a little extra homework in these days of sheltering in place, because with the pandemic, individual agencies have their own policies set up in terms of, you know, protective equipment, and, you know, if they're going to go into a home that has somebody who has tested positive for COVID-19 or not. So just be aware of those things, and again, ask some precise questions.
Yeah, if I may add, that's an important point, I think, right now, just to reinforce that providers of non-medical in-home care are non-medical, right? So they're not regulated by the same types of requirements that that healthcare facilities are. That's not necessarily a bad thing. I say it only to emphasize that point, that they all do have infection control procedures in place. This is a standard part of non-medical in-home care training. And they're all really ramping that up right now, enhancing their infection control procedures. But just recognize that there aren't standard protocols for this for these providers. Nationwide, statewide, it's really up to them as individual providers. So ask questions about that.
Yeah. And again, you know, if you're uncertain of what questions to ask, give us a call at Alzheimer's San Diego, and we'll help you to craft those questions. So we're going to move along now and talk about some of the community-based services that are out there. And again, the disclaimer that many of these programs are, not all of them, but many of them are not operating right now. Mm-hmm. So we'll give you the lay of the land, and again, understanding that things might look somewhat different when we come to the other side of this. So there's senior centers all through the community, and I'm such a big fan of senior centers. I think they're so fantastic. I think it's a great way to start to introduce kind of programs and care and other people into the lives of seniors living with all different types of situations going on. I think it can be very helpful for people living with dementia. Unfortunately, all the senior centers are closed at this time. So, but, you know, when they do open, give them some thought as a way to start accessing some community supports. There are programs called PACE, meaning Program of All-Inclusive Care for the Elderly. And these programs are really intended for folks who are on Medi-Cal and who are at risk for nursing home placement. And I believe the majority of the PACE programs are either not operating or operating on a limited basis right now. And if you've got more questions about the PACE programs, again, please give us a call at Alzheimer's San Diego. There are some great case management services around our county, and some of these are provided by agencies. We don't provide case management through Alzheimer's San Diego, but we can get you connected to some agencies who do you know, a really stand-up job. So for sure, talk to us about that. And then we can't talk about community-based services without talking about ourselves, Alzheimer's San Diego. You folks know a little bit about us, and we'll chat more about all our programs and services that we are now doing virtually towards the end of today's presentation. So let's get started with adult day programs. Okay, so, and once again, my understanding is that all of the adult day programs that have been in operation are currently closed. One of our participants that I was talking with just before the program started today said she had received an email about a program that was possibly opening, but it sounds a little bit uncertain as yet. So understand that, you know, right now most of these programs are not operating. However, when they are, adult day programs can provide just a really rich and supportive environment for people living with dementia. And a lot of it is recreational, so we're talking about activity programs. They're keeping folks busy and engaged and involved, and that's a good thing for our people living with dementia. So, and then they also can provide some therapeutic services. So there are some different types of adult day cares. So the social programs, or the ADCs, adult day centers, are the ones with a real focus on activities and engagement. And this is terrific for our folks with memory loss who are still in the potentially earlier or early moderate stages. The social programs do not provide physical assistance. So with managing toileting, with managing the bathroom, they don't provide assistance with eating, and they also do not administer medications. So these are good programs for folks who can still manage those care needs on their own, but really would benefit from the activities and the engagement. The adult day health care, ADHCs, offer the same in terms of activities. They do all sorts of different things, from exercises to music to craft type programs to seasonal activities. In addition though, they also have a therapeutic aspect to their programs, oftentimes with an RN on staff that may not be there all day, every day, but will be there and can do things like check blood pressure, administer medication. And they often are bringing in on a regular basis some ancillary medical services such as physical therapy, occupational therapy. What else, Amy? Am I missing?
Each occupational, yeah.
Yeah,
got it.
Okay. So, so folks, when they have some different things that they're dealing with in terms of mobility issues and recovering from injuries or falls or whatever, they can get those services as well too. The non-licensed older adult programs. There's one of those here in San Diego, and it's really fantastic. And of course, it's not meeting right now. And it is through Jewish Family Services. It's the Balboa Older Adult Program. And it is really more of a social program as well too. It's quite fantastic. The director of that program is just a bundle of energy and positivity. So hopefully she can get back to spreading all that good stuff around sometime in the near future. And let me just say very quickly, when I mentioned Jewish Family Services, please know you don't have to be Jewish to access their services. That's, their programs and services are open to anyone, regardless whether you're Jewish or not or whatever it might be. So what's the good things about these adult day programs? Well, they are benefiting not only the people with dementia, but also the care partners. This is a form of respite for care partners, and that is a good thing. You need a break, folks, as care partners. You need a break. And the other thing is, it's hard for care partners. I'm saying this, so I imagine many of you know this right now. When you're with your person 24/7, to be everything from the caregiver to the wife to the meal maker, the house cleaner, the laundry doer, the cheerleader, to keep your person active and engaged and redirected, and all those other different roles that we talked about, that the different hats people wear. when these programs are up and running, if you would like to explore it more, please give us a call. And, you know, they are really fantastic programs for all that are involved. These programs are often referred to as community-based adult services programs, or CBAS. I have no idea, we talk about this in this class all the time, Amy and I do. When we talk about long-term care and all the different services and programs that are out there, there's a lot of acronyms. I have no idea why this area is heavy with that, but it is. So if you hear somebody referring to a CBAS or a community-based adult services program, this is the kind of thing that they're talking about. Average costs are, I want to say for a full day before sheltering in place of what, about $85 to $95 a day. I'm questioning, Amy? Yeah, sorry.
Yeah, there are some that are over 100, but it's generally in that range.
Yeah, and then many of them offer half-day options. Don't necessarily take that to mean then it's half the price. They're still usually in the, I don't know, $65 to $75 range. But again, we don't know what this landscape is going to look like when sheltering in place, you know, is not part of our agendas anymore. So we'll have to wait and see how things are going to look. So finding a program, give us a call. That's probably the best and first thing for you to do. As centers are starting to open up, you know, we'll be monitoring that and paying attention. So I think call us first and foremost, and we'll give you the guidance that we can. For sure, there will be questions to ask. In addition to what you see here, you know, what are the activities and the services that go on? Do they have specialized dementia training? And if they do, what does that look like? You know, how are costs managed? So is it all private pay, or do they accept Medi-Cal or VA? And what are the transportation options? Do they have a van, you know, a van that will pick people up and take them to the center, or are there other options? And in addition to this, you know, I think we'll probably have a whole set of questions that's related to infection control and, you know, how those things are being managed with potentially multiple people in a program. Maybe I would suspect they'll be reducing the number of participants that can come to some of these programs. But goodness only knows, there'll be other things as well too. So we'll be, I expect that in the future, this will be a different slide in future presentations. It is possible though to work with the staff at these centers to coordinate a visit or a trial day, just to give it a go.
Jean, there were a couple, a question and a comment before I talk about residential care, just because they were specific to adult day programs. Okay. So the first was, do clients have to be able to manage their continence independently in order to attend a day program?
So that is a good question. And what I will go back to, I'm actually going to go back to here, to this slide. So the social day programs that are in the community where it is, you know, activity-based, these programs do not provide personal care. So the participants that are going do need to be able to manage their own toileting. And, you know, if they wear incontinence products, that's okay. You know, thinking that that's maybe preventative, or if there's just a little bit of bladder leakage. But to be able to go to the bathroom and use the toilet, and if they needed to change their incontinence product themselves, they need to do that independently. The adult day health programs, the ADHCs, can provide that level of assistance in the bathroom with toileting.
Yeah, so those are good questions to ask when you're interviewing and visiting places. What limitations do they have in terms of the person's function?
Mm-hmm.
So, and then I just want to share, if you didn't see it in the chat there, we have a colleague from Jewish Family Service with us in the program here today, who mentioned that the Balboa Avenue Older Adult Center that Jean spoke of a few moments ago is still doing virtual programming. So very cool. So, thank you, Colleen, for letting us know.
All right, Amy's taking over now.
Yeah.
So
I'm going to talk now about this this other aspect of the long-term care, the world of long-term care, and that is what we refer to as this continuum of residential care. So all of the services that Jean has spoken about up to this point, those are services that are provided to people who live in their homes. Either they're services that are brought into the home, or there are services out in the community that are meant to provide a bridge to a person who's living at home. These services that I'm speaking of now for the next few minutes, these are residential in nature. A person moves in. So that's the difference. So we'll start by talking about what are referred to as independent living communities, or sometimes senior communities, or sometimes they'll be explicitly age segregated. They'll say this is 55 plus or 65 plus, for example. Technically, independent living, which you'll frequently see abbreviated as IL when you're looking through materials about residential care, this is not actually, they're not licensed to provide assistance with any of those activities of daily living that Jean was speaking about. These are non-licensed residential units. So one is expected to be fully independent with all of your activities of daily living, to not have any significant cognitive impairment, to be able to manage one's medications, all of those types of things. Some independent living communities do offer some of those non-medical sort of additions, things like communal meals, a dining room may be an option. They may have housekeeping services or laundry services, but your unit is self-contained. You know a unit is an independent living unit because it's got a kitchen. You can cook in it. It doesn't mean you have to, but you can. Whereas if we're talking about assisted living, the expectation is that one requires assistance with that, and so full kitchens are not provided. So that's sort of a hint. So these communities, these apartments, they're usually apartments. Sometimes they're standalone cottages, but again, they're not licensed. They're not technically considered long-term care, but I think it's important to talk about them because when you're out researching or visiting communities, you're going to see this terminology, that this is our independent living building, for example, or this set of apartments is designated for independent living. A continuing care retirement community, which you see down at the bottom of that graphic there, refers to a community where there are multiple levels of care. And if you're moving into a Ccrc, in many cases, the expectation is that you move in while you're at that independent living level of care. So there is typically an assessment done to make sure that the person sort of meets that criteria. So in terms of the costs of independent living, it's a little hard to predict or it's a little hard to quote because it's all over the map. It's basically rental. And so, you know, if you've lived in San Diego County for a long time, you understand our rental market. It's all about size and location, right? Where that property is located, because it really isn't, they aren't providing those hands-on custodial care services. So it's it sort of follows typical apartment rental rates, but maybe a little bit higher than average. So here now we're talking about actual long-term care being provided. So residential care facilities for the elderly, RCFEs. This is the regulatory language that we use to describe these three different sort of types of environments that are all licensed the same way. They hold a license from the state of California that allows them to provide non-medical assistance with activities of daily living. Non-medical, they are not allowed to provide medical services. That's not to say that one can't live in an RCFE and receive medical services, but they need to be provided by a licensed healthcare provider who is brought in from the outside. So a home health nurse, for example, or hospice services. Those are medical services that can be provided in an RCFE setting. But the staff of a residential care facility for the elderly are not permitted to provide medical services. But that boundary between medical and non-medical is a little tricky, and I just want to sort of acknowledge that boarding cares and assisted living and memory care communities do provide very intensive hands-on services. So that's not to say they're not helping with pretty intimate personal care tasks. They just aren't providing invasive medical services. So they can help with bathing and grooming and toileting and peri-care, for example. They can provide transportation and social activities, for example. All of those non-medical custodial types of care. So they come in kind of three flavors, if you will. Board and care homes, assisted living apartments, and dementia or memory care apartments. They're all licensed the same way. They all have an administrator who holds an RCFE administrator's license, but they come in different sizes and varieties, if you will. So a board and care is typically a small private, or it's a residential home. From the outside, you wouldn't even probably know that this is a provider of residential care services. They don't have signage, and they don't usually have vans that are taking people places because they're small and they're intimate. There's generally a pretty small staff. There's usually somewhere between 5 and 7 bedrooms within the home. Most people who live in a board and care will share a bedroom with another person, but it is possible to pay extra and have your own private room. But basically, you're paying two people's rent. So board and care homes are sort of smaller and quieter and can be a really nice fit for somebody for whom the larger assisted living environment would be sort of overwhelming. And they also cost less because they don't have all of the amenities that a typical, what we refer to as assisted living, they don't have activities directors and those transportation services, those types of things. It's more like living in a private home. Assisted living is probably what most of us think of when we think of residential care. These are the larger buildings. There's no technical sort of boundary at which, or number of apartments or units or residents at which we call it assisted living versus board and care. But sort of informally, we tend to say if there's 13 or more residents, we'll just use the term assisted living, but they're providing the same services as a board and care, all those same non-medical custodial types of support. So one can have a shared room in an assisted living apartment or one's own apartment. They typically are studio apartments or 1-bedroom units. Occasionally you can find 2-bedroom units, but they're not that common anymore. An assisted living building is likely to be part of one of these campuses that has multiple levels of care. There's independent living apartments and assisted living as well. So a person would undergo an assessment. You need to have some paperwork completed by a physician. It's called a RCFE physician's report. It's a fairly simple it's kind of long, but it's a simple document that you take to the doctor and they fill it out and just sort of attest to your diagnoses and your level of functioning so that the community knows, what medical conditions you have. And then they will typically also do their own assessment. A nurse or a social worker, an admissions person will be doing an assessment to determine your level of function and how much of that, those supportive services are required. The tricky thing about assisted living for the families that we serve at Alzheimer's San Diego is that it is not designed to support people who are living with dementia. In a boarding care home, most boarding care homes, in assisted living environments, a resident can come and go as they please. Right? They have a lot of support, but it is not a locked or secured campus. Many people drive and live very independently. They just need assistance with those activities of daily living. Well, people who are living with dementia, at a certain point, we have to prepare for the eventuality that they will begin to lose capacity. They will begin to experience moments of disorientation, confusion. And because of the risk of wandering in particular, most assisted living, in California, there's actually regulation that says they cannot have residents who have a primary or secondary diagnosis of Alzheimer's or another form of dementia. Reality is there are many people in boarding care homes and assisted living communities who are living with Alzheimer's disease and dementia. They lived there before and their symptoms have progressed, but that is the reality for admission. When it comes to dementia and memory care, these are also licensed RCFEs, residential care facilities for the elderly. But there's a couple of differences. They require additional training specific to dementia behavior, understanding the disease and understanding dementia behavior management for the staff. And then of course the campuses themselves, the buildings or the perimeter around the building or both in most cases are locked, are secured. So that, and residents cannot come and go freely. So that's the primary difference between assisted living and memory care. Although technically memory care is just a type of assisted living. I hope that is making sense. So as you see on the bottom there of the screen, the average cost of assisted living in California in 2019, Genworth, by the way, puts out this survey every 1 or 2 years. So that's the most recent number that we have. The average cost in California is about $4,500 per month. That doesn't totally track here in San Diego County, where the costs for assisted living are probably a bit higher on average, but absolutely one can find an apartment assisted living easy for $4,000 a month on up. And I always kind of catch my breath when I say those numbers out loud. I know I say them sort of casually, and I don't mean to sound cavalier about them. They're big numbers, and this is this type of care is very costly. So in San Diego County, the costs here, I'd say boarding care for a shared room in a boarding care, you're looking at somewhere between $2,000 and $3,000 a month, probably. Assisted living apartments in San Diego County range, they're all over the map. I'd say anywhere from $3,500 to $5,000 or $6,000 probably for a very high-end, larger apartment. Dementia and memory care is clearly the most expensive type of care. And it's probably more on track with that $4,500 a month average, but it's easy and not uncalled for, or not uncommon at all, to see rents for dementia or memory care, I should say not rent, but fees for dementia and memory care to be upwards of $7,000, $8,000, $9,000, even $10,000 a month. That's not uncommon here in San Diego County. It's very intensive 24-hour care. I do want to emphasize that nursing, having licensed nurses on staff 24 hours a day is not a requirement of an RCFE because they're not providing medical care. But many of them do have nurses, either providing case management to people who may be following them when they're coming in and out of the hospital, but also on staff nursing, sort of overseeing the services that are being provided. Med techs and LVNs that are helping with medication management, that type of thing. So it's very expensive. The staffing is expensive. The real estate is expensive. Certainly the caregivers are doing hard work, and it's risky work. So as with, go back, we're fighting. As with home care, right? Ensuring having adequate workers' compensation insurance to cover the risks that are inherent in the provision of long-term care. All of that sort of makes all of these services very expensive, especially here in California, but really anywhere. So skilled nursing facilities are, oh, Jean, are you getting my attention? I don't know why you're muted. I didn't mute you. Yes.
Zoom just really wants me to keep quiet.
It does. I'm not doing that to you, I swear.
So, but I'm taking control over Zoom. We've got a couple of questions about RCFEs.
Sure.
So what about medication management in RCFEs? How is that managed? Is that considered medical?
Oh, that's a really great question. Yeah, thanks for that question. No, the management, the administration of medications is not, it's very tricky. It's not considered a medical task. So RCFEs absolutely can get the medication, set it up, and administer it, meaning they can give somebody reminders to take their own medication or hand it to the person. They are not allowed to, actually, give injections, those types of things.
Right. Or like,
although there are waivers for that, so sometimes they can't.
So if the pills were in like a little cup, they wouldn't be able to like say, oh, open your mouth and tip your head. So people need to take the medications there.
People need to be able to, in assisted living, people need to be able to get the pill down themselves.
Yeah.
Mm-hmm.
A couple of other questions. There was a question about, you mentioned, what is this? You mentioned a secondary diagnosis of dementia. What is that?
Oh, just me. So this is just kind of a nuance of that particular report. So this physician's report that RCFEs are required to have before a person can move in, the doctor has to tell the RCFE, here's this person's primary diagnosis and here's this person's secondary diagnosis. Yeah. So it's pretty subjective. The doctor could make a decision that, yes, this person has dementia, but I'm going to put it way down on the list, maybe make it their third or fourth diagnosis, because I don't think that it's relevant to their function. Whereas a person could have arthritis, for example, could be their primary diagnosis, because that's the thing that affects their level of functioning the most. So it is kind of a subjective thing.
Okay. And another question I think is really good, because we get this a lot in our calls on family services, is what about for married couples where one person has been diagnosed with Alzheimer's disease, but the other doesn't have dementia? How do they, go into an RCFE? Can they live together, or do they have to be in separate places? What's the
Yes, this is one of the great unsolved problems, I would say, when it comes to residential care. Particularly, I'm going to go back here. Particularly when we're talking about dementia and memory care in particular. Most communities don't have any sort of an official prohibition against a married, not necessarily married, but a couple, two people living in the same memory care unit apartment together. But it's really problematic to have somebody who does not have dementia living in a dementia care community. It's a very unsatisfying environment, unstimulating, and difficult for a person without dementia to live in that environment. So what most people would prefer to do is, I'm the well spouse and my spouse has dementia. We'll both just together move into an assisted living apartment. We want to move into the sort of lower level of care, but that's where it really gets tricky, because they're not allowed to do that. If the person with dementia has that primary or secondary diagnosis, they shouldn't be in an assisted living environment. The reality of that's the rule. That's how it works. The reality of that is, if the person with dementia is still in the very early stages, they're functioning very independently, the physician may not make that one of those primary or secondary diagnoses. The assisted living building may, ask the family to bring in some supplemental support, some one-on-one caregiving that can supplement what the spouse or the partner is providing. There are definitely ways around it, but it gets expensive. And for most people, what they end up doing is the well spouse stays home, and well spouse, that's just sort of insurance, that's just lingo. We're just talking about the person in the pair that doesn't have dementia.
Yeah.
The well spouse usually stays home, or they move into an independent or assisted living apartment, and the person with dementia moves into the memory care unit. They're in the same building or they're in the same complex, but they're not actually living together. This is not ideal. This is not what most people want. We just don't yet have sort of good housing units for pairs like that.
Good, thank you.
Yeah. Okay. I know there are some more questions. I think Jean was just asking those couple specific ones because they were relevant to that particular topic. We'll come back and answer questions again here in a bit. So the last level within this continuum of residential care is the Sniff, skilled nursing facility. We often refer to them as SNFs. Skilled nursing facilities are a little tricky in that they are both providers of healthcare, medical services, as well as non-medical long-term care services. So if a person is living in a skilled nursing facility long-term, they are receiving custodial level care. They're not there because they are temporarily recovering from an illness or an injury, right? When that's the case, when you're rehabbing from something, Medicare or your private insurance is going to cover all or most, quite a lot of your stay in a skilled nursing facility because that's medical services, that's healthcare. If you're living in a skilled nursing facility on a long-term ongoing basis, because you have needs that can't quite get met in an RCFE. So this could be something like a feeding tube, for example, or if it's a person has poorly controlled sliding scale insulin needs, for example. You need nursing services, you need medical services that an assisted living or memory care building is not licensed, they're not permitted to provide. You may move into a skilled nursing facility on a long-term basis. And unfortunately, if that's the case, you're paying for that out of pocket. Medicare isn't going to cover it, as we will address here in a moment. Skilled nursing facilities are very expensive when you're paying for them out of pocket, when Medicare or your insurance is not covering them. The average cost in California is about $350 a day, and I do think that tracks pretty closely with the rates we see here in San Diego County. So very expensive, right? Map that out over the course of a month. You're talking $10,000 a month out of pocket on an ongoing basis. So obviously not ideal. These costs, and of course, skilled nursing facilities are they're institutional feeling. They feel like hospitals because they are healthcare facilities. So it's the least homey, the least sort of comfortable, I want to say, of all of these environments. But good care, comfortable care, a cozy little setup with a few pieces of your own furniture and your own stuff can make a really good difference, and good care in a skilled nursing facility and all of these levels of care actually is absolutely possible with a smart choice and good advocacy. So I mentioned this one already, but a CCRC, a continuing care retirement community. There's a couple of different flavors of these as well. The true buy-in CCRC model, wherein a person makes a very large upfront payment and then they sort of own, if you will, you kind of own, you're guaranteed to be able to stay in that community as long as you live. Those are pretty rare. We only have a couple of those here in San Diego County. They're more popular in other parts of the country. We do have a few of them here though. But it's important to recognize it's not like you buy in and then your care is just covered for life. You continue to pay monthly fees for your unit, for your apartment, as well as for the services that you receive. So if you're in independent living, your rates will be much less than if you're in assisted living or skilled nursing facility, but they have all of those different levels of care so that you don't, hopefully the idea is that you don't have to move as your needs are changing. But it is important to recognize that you are not likely to stay in the same apartment, right? You're likely to have to physically move as your needs are changing. Yes, Jean.
So we have a question about this, about a continuing care retirement community. And the question is, if the person living with dementia is in memory care in the continuing care retirement community, can the community compel a family to hire private caregivers for their person in the memory care at the community?
Yeah, unfortunately, it seems crazy, but I mean, crazy is not quite the right word here. But yes, that is unfortunately not uncommon at all. The Ccrc's guarantee that you can stay there does not guarantee that they'll always have room for you in the unit that you need to be in. You could be in assisted living, for example. And you need memory care. Your dementia symptoms are developing. You need that additional support, but they don't have room in their memory care unit. They're not obligated to make it work for you. They can let you out of your contract, and they can compel you to hire additional services so that you will be safe to be able to remain in your assisted living apartment. So too, if you're living in the memory care unit and your needs exceed what their staff can reasonably provide, and that does happen from time to time if a person has a really significant sleep disturbance, or usually it's more about behavioral symptoms. It absolutely happens that a community will say to a family, like, in order for your loved one to be safe here, we have to ask you to hire some one-on-one, some supplemental assistance. It does happen. Yeah.
Okay, thank you.
Okay. So very briefly, I'm gonna keep an eye on the time here. This is not meant to be inclusive here. It's just to give you a flavor of some of the questions that we provide. We have a checklist that we can send to you if you ask for it, that you can use to evaluate memory care. If you're looking around at residential care options, some questions you can ask, some things you can use for points of comparison. So again, at the end of the program, we'll give you an email address again where you can request this, but do know we've got this in a PDF, a printed form that you can use. So you want to, of course, know what their licensing status is, what kind of violations have they had recently. Most importantly, just look at how they've addressed those violations. Right? Having violations doesn't necessarily mean it's a bad place, but you do want to look at what changes have they made as a result of them. Right? Where in the county or the region, in the country, wherever, is it located so that it's reasonable for friends and family and members of the support system to come visit? Of course, cost is a huge consideration, and there is nothing wrong with making a choice about residential care based on what's financially feasible for you. That is a totally reasonable consideration. The physical facility, it's important. It's not the end all be all, but certainly you want to feel comfortable with the way it looks and feels and smells and how accessible it is. The quality of care, probably the most important thing, probably the hardest to really get your finger on, but ask about how they train their staff. Watch the staff for how they interact with the other residents. Talk to other people that live there or the family caregivers that are coming and going, and find someone whose sort of needs match yours and see how do they do? What's their perception of the quality of care? Do know that staffing ratios are not mandated by the state of California. There's no specific sort of target ratio you want to require or be after, but it's not a bad question to ask. It's a good point of comparison to ask between different communities. Ask about all those different services and amenities, recognizing that they're all so different. Some offer more and less. What types of activities do they offer? Right? If you really love animals and you want to be able to keep your cat, that's a really important consideration. Ask about those special activities and offerings. The food, of course, is really important for a lot of people. How does that work? How does it taste? Just consider what is most important to you and base the question on that. So I'm going to pause here for a second and see if there are any questions in the chat that I have not already gotten to. So bear with me here. Okay. Okay, just see one here. The average cost of home care that was quoted at $27 to $35 per hour. I assume that that's for agency obtained providers. What about the average rate per hour for privately retained providers? Yes, that is a correct assumption. At Alzheimer San Diego, we generally do, advocate for the use, working with an agency where the caregivers are employees of that agency. That's why it costs so much more. They're absorbing all of the risk, right? If somebody gets sick, if somebody gets hurt, if somebody is going on vacation, or if somebody needs more training, this just isn't the right fit of a client for them anymore. All of that responsibility, all of the taxes, all of the insurances, all of that is paid for by the agency rather than being on the shoulders of the family who would otherwise be the employer when you hire privately. Really important to know, the IRS does not recognize a caregiver, someone who's providing this type of assistance with non-medical activities of daily living. They don't meet criteria for independent contract work. So you are considered the employer. You are expected to take those withholdings, right? Have a payroll system in place and insure them. So that's important to know. The average rate for privately retained providers, I honestly don't know anymore. It's been a while since I gathered that information. Anecdotally, I'd say I know of families who pay sort of under the table, cash, $15 an hour or so. It's not unheard of, but it's a very risky scenario. So it certainly costs less to employ somebody yourself, but think about all of the scheduling and all of the sort of added on risks and costs, and it's not that much less to hire privately than to work through an agency. Okay, so now let's talk about, we've been quoting you some really expensive big numbers. I'm just going to do a very high level kind of run through here on how people pay for long-term care. I want to connect you to our legal and financial basics class where we dive into this in much more detail. There's a recording of that webinar up on our website, but we also we offer it live on a regular basis. So we'll be doing that again sometime soon, probably in the summer, where we go into all of what I'm going to talk about here for the next few minutes in much more detail. And then, of course, our social work team has more detailed information about all of these benefits and all of this that we can send you as well. The bottom line is that long-term care is not paid for by insurance. If there's one important thing that you take away from this program, it's that. Medicare, TRICARE for Life, Blue Cross, whatever it is, those are providers of health insurance, which provides great coverage when you need medical care. Long-term care is everything else. It's all those things Jean was talking about, what is considered custodial or non-medical care. So we are expected to pay for that ourselves. And we don't have an insurance, a public health insurance a public long-term care insurance program in the United States. So people typically pay for this out of their personal savings, their assets. A lot of families will pool resources together. If you have a long-term care insurance policy, terrific. Get it out right now. Dust it off and get familiar with it. Ask for a benefits review today. So even if you're not going to need to open a claim for a long time, get familiar with that policy. They're all different. They've changed significantly over the years. They have all different kinds of things they cover and don't cover. So get familiar with it. If a person has already got a diagnosis of dementia or any other chronic condition for that matter, they will not qualify to purchase a new long-term care insurance policy. But if there's already one in place, do not let that go to waste. We see that happen all the time. People kind of pushing it out further and further, thinking that it's for something that's more extreme. It's for the rainy day, but use it just as soon as you can. Too many people let those go to waste. There are some financial tools that are out there to help people who don't have the personal savings and assets, don't have the cash to pay for long-term care because most of their assets are in-house. That's a very common scenario here in Southern California. So reverse mortgages, life estates, charitable gift annuities, or even the conversion of a life insurance policy that you no longer need. These are tools that are available. Talk with a financial planner about whether or not they're right for your particular situation. And then for those who do not have those resources, those assets, we have the Medicaid program, which I'll talk about here in a moment, and the VA as well, which offers some limited but pretty great benefits for covering the cost of long-term care. So Medicare, it's really here just as I want to introduce it before I talk about Medicaid to tell you what Medicaid is not, because there are two words and types of insurance that often get mixed up with each other. So Medicare is health insurance. It's our federal health insurance program. We pay for it through our Social Security deductions. It's an entitlement program. You get it if you need it or not. It doesn't have anything to do with your health, and it doesn't have anything to do with your financial situation. We all get it as long as we paid into it or we're legally married to someone who did, right? Those work those enough quarters to earn the Medicare benefits. So it's health insurance. It does not cover the cost of all of these types of services that we're talking about here today. It's for hospitalizations, doctor visits, specialty visits, specialist visits, I should say, and if you are getting rehabilitation services in a skilled nursing facility or getting short-term home healthcare services. That's nursing or therapies that are provided in the house. It covers that, but it does not cover long-term care. So Medicaid, which in California we call Medi-Cal, this is a needs-based program. Everybody pays into the Medicaid program, but not everybody qualifies for Medicaid or Medi-Cal. It is jointly funded between states and the federal government. It provides health insurance to low-income families, but it also has some pretty important provisions for long-term care. So every state has its own program. If you're not caring for somebody who lives in California, then these points that you see here don't necessarily apply. The thresholds for qualifying for Medicaid, as well as what services you're eligible for, if you have it, are totally different in every state. So talking here just about in California, important to know, it is not necessarily, we think of it as a low income program, but in fact a person can, it's really more of a low asset program. A person can have an income of any amount and still qualify for Medi-Cal. But if you have a higher income, you're going to pay what's called a share of costs. The state of California will ask you to help them in paying for the expense. So it's really kind of a middle income program. It's not necessarily low income. It's not as difficult to qualify as I think a lot of people think. But having said that, the benefits are limited. You can't qualify for Medi-Cal and then just go move into any assisted living apartment that you want. right? Your range of options is limited. So when you have qualified for Medi-Cal, you will be assigned a case manager who will determine what benefits you're eligible for. So that may be some in-home supportive services. That's not 24-hour care at home, but maybe a few hours a day of that non-medical in-home support. Adult day programs, many of them in San Diego County do accept Medi-Cal as a form of payment, which is terrific. When Medi-Cal pays for it, it's called a CBAS. That was what Jean was talking about before, the community-based adult services, but we're talking about adult day programs. So Medi-Cal does cover participation in an adult day program. And it does cover a long-term custodial stay in a skilled nursing facility. So this is ultimately our safety net here in the state of California. If a person does not have private assets to pay for the cost of long-term care, or they did and they outlive them, they run out, a person can certainly qualify for Medi-Cal, and then Medi-Cal will cover a stay in a skilled nursing facility. This is not ideal, but it is our safety net. It's what we have. Here in San Diego County, we have a limited, very limited program called the Assisted Living Waiver. This has sort of been rolling out over the years, county by county. The state of California is looking into would it save money if instead of only paying for people to live in skilled nursing facilities, if the state of California pays for people to live in assisted living, in a board and care home, for example, or an assisted living apartment, will people have a better quality of life, and will the state save money? So, I mean, the answer, I'm certain, will be yes, but they're still studying that and looking at it. It's still a very limited program, but once you are on Medi-Cal, you can put your name on the assisted living waiver list. At the moment, it's a pretty long list. Last time I heard it was about 8 or 9 months. Have you heard anything different, Jean?
Yeah, that's correct. Actually, even up to a year.
Okay, so it's long, it is limited, and at the moment, there aren't memory care apartments even on the list of providers who take the assisted living waiver, so it has very limited utility for us right now, but we do still want you to know about it. And then, of course, if the person with dementia is themselves a veteran or the surviving spouse of a veteran, there are some benefits. Most of us know about the health insurance that's provided through the VA, the service-connected disability income that a person can be eligible for. But there is in particular one pension called the Aid and Attendance Program, which is a non-service connected cash payment. It's a pension for individuals who have health or long-term care needs that exceed their monthly income. So you do have to already be putting out money related to a chronic condition, a need for those activities of daily living. And then one can apply for the Aid and Attendance pension. And the benefits I see, I think, typically between $700 and $1,400 a month, pretty standard. So this is wonderful. And this is cash. This can be used it can be used in any setting to pay for home care, assisted living, memory care, any type of setting. So also, if the veteran is a caregiver to somebody, there are some wonderful benefits available through the VA's caregiver support program. The VA will pay for adult day healthcare services, those CBAS services. There are some limited homemaker and home health aid funds that are available, as well as sometimes, just sort of depends on how well this program is funded at any given moment, there are funds available for respite, being able to move your person into a residential care setting on a temporary basis so that the caregiver can get a break. Very important. Okay, turn it back over to Jean.
I am going to go quite quickly here through resources and support, just in the interest of time. But please know any questions you have about these resources. I'm not going to give you explanations on them, just touch very briefly on them. Any questions you have, please give us a call at alzsd.org, and we'll be happy to talk through them with you. So this is I think the most important slide here is starting the conversation. Again, I made mention of this at the start of our presentation today, is the number of calls we get on an ongoing basis from families having to react in crisis mode about identifying supports and resources, whether it be at home, in the home, or looking for a care facility or whatever it might be. Oftentimes people are having to react in a crisis mode situation. And we don't want that to be happening to any of you folks. So start your conversation. That means getting the right people to the table. So, you need to be assessing what financial resources are available in terms of paying for the cost of care. Who are the decision makers, the healthcare decision makers? You need to just get everybody together that has a stake in things to be able to come together with a plan and a good idea of how you're going to proceed. And you can start exploring options before there is a need. I do know some families, and kudos to them, who have made contact with in-home care agencies, had their assessments and have services ready to go, are not utilizing services right now, but know that they can contact that agency at a moment's notice to get some in-home care happening right away if the need should arise. Assess your finances for sure. This is going to be one of the things that dictates which way you go in terms of choosing care options. And then connect to your local resources. So aging life care professionals, this is a very specialized type of professional with just lots of education and training. And there's kind of not too much that these folks can't do. And they're a terrific resource for you if you are able to utilize them. These professionals do bill by the hour. And what would be about the average cost right now, Amy?
I think it's $150 an hour, probably.
Yeah, something along that line. Some families work with aging life care professionals over the course of, time, and over the course of time of their person living with dementia. But know that you can also just bring them in for brief periods of time for assessment and recommendations. So, sometimes it's worth it to spend that little bit of money to get that objective and very professional eye on things. All right, come on. There we go. Professional fiduciaries. I'm just going to let you do that, okay? Professional fiduciaries are another type of person that you can have assisting you as a family, as a care partner, or for your person living with dementia. And these folks can manage all sorts of things. Oftentimes it's finances, but they can also become decision makers for healthcare and other matters. In California, these folks are licensed, and I believe we're the only state that has that licensing requirement for
I think so.
So all sorts of services that they can provide. Here's a couple of good websites for you to go to find out who some of those fiduciaries are. And that's just a great resource for some families, to be sure. All right. So here's some resources for placement and relocation. California Department of Social Service, this is where you go to be looking for those licensed in-home care providers, and also for the RCFEs that Amy was talking about. Choose Well, this is a website to go to find out about assisted living facilities here, specific to San Diego County. The National Association of Senior Move Managers, these are a great resource, great folks. They can come in and assist seniors either with or without dementia with downsizing and organizing and moving, and that can be a terrific resource as well too. For any placement and referral agencies, we do want you to contact us, and we'll give you the information on that. Resources for information and advocacy. The California Advocates for RCFE Reform, or CAR as we speak of them. And then the California Advocates for Nursing Home Reform, or CANR. These are some of the folks that, you know, have been the lobbyists and the advocates for changing some of the laws and regulations regarding our RCFEs and our skilled nursing facilities, our Sniff.
There's just a ton of good information on libraries of good information on those websites.
Absolutely. So, and these folks, you know, they continue to monitor these situations too, as well. So there are great, just as I say, advocates. CalQualityCare.org. This is through UCSF and the Institute for Health and Aging. Great information there as well on all sorts of different things. And for hospice and palliative care, this is the website you want to go to. We're talking end-of-life care with hospice and palliative care. So for long-term care regulatory agencies, this is the California Department of Social Services, the Home Care Services Bureau. So these are, again, the folks that the website that you can go to get information on those in-home care agencies that are licensed and operating in our community. And then the California Department of Social Services, the Community Care Licensing Division. These are the folks and the website that is overseeing all those licensing and regulation for the RCFEs that Amy talked about. And in a similar vein, the California Department of Public Health is the agency that provides oversight for the skilled nursing facilities. In San Diego County, local resources, Elder Help of San Diego, great organization, all sorts of different things that they provide. So have a look at what they can do for you. This website, FACT, Facilitating Access to Coordinated Transportation. I love this website. And it's specific to San Diego County. You can go in and find out about all the different transportation options that are in your area. And it's easy to use. The Health Insurance Counseling and Advocacy Program that we call HICAP can help with any questions related to health insurance and Medicare. Great resource to go to, especially during open enrollment. Jewish Family Service of San Diego, I mentioned these folks earlier. They provide just a plethora of programs and services, everything from case management to the older adult program that I mentioned to some goods transportation programs here specific to our San Diego area. Have a look at what they're doing. There's our county website, San Diego County Aging and Independent Services, and then the Southern Caregiver Resource Center. They, in particular, provide some great respite programs to the community. Where those respite programs are right now with the pandemic, I don't know. You would need to contact that particular agency. Here is Alzheimer's San Diego, all the different things that we are doing at this point in time with sheltering in place. And so there's lots going on, as you can see, and all of it virtual and or by phone. So lots of different things we can do for you folks. Give us a call or visit our website. There we are. There's our website, alzsd.org. There's our phone number. We've got just a great library ourselves of information and resources. Give us a shout.